today. My name is Arthur Chen. I am a practicing family physician at Asian Health Services, which is a community health center located in Oakland, Chinatown, in California. I've been there for about the last 27 years and have continued to establish a practice both in the outpatient and inpatient side. One of the things that I focused on earlier in my career was doing research, in which we conducted a neighborhood survey of behaviors and knowledge of Chinese community members regarding such things as high blood pressure and high cholesterol and preventive screenings like mammograms and pap smears, because we didn't know what the community awareness was regarding these early interventions and things that they could do to lead more healthy lives. As a result of that, we got our results analyzed and discovered that there were actually big knowledge gaps about mammograms, about high blood pressure and the association of salt intake, where a number of people didn't realize that salt contributed to high blood pressure, certain foods contributing to high cholesterol, and failure to really get mammograms and other preventive tests that are very helpful in early detection of cancer. So as a result of that, we were able to get it published in the CDC publication, the Center for Disease Control publication, which is called the Morbidity and Mortality Weekly Report. And we're able to get a lot of attention to these issues because it was real data that has been compiled, and began us on a course of doing a lot of compiling of information and surveying at the local level of what was happening within the different segments of the Asian and Pacific Islander community. We did this in collaboration with UCSF in working with their Vietnamese community, and then also did an additional survey in looking at the same kinds of knowledge and behavior and attitudes within the Korean American community. Overall, from conducting this type of survey, we learned that we as a community-based organization, a community health center, could actually carry out research in our communities and do it in a very sensitive way that was respectful of the population, and that just as importantly, we would use the information that we learned to get the word out and to understand more of what was going on with them, so that we could build stronger ways in which we could address some of the knowledge gaps and also enhance more preventive behaviors among the population. So it was a really wonderful experience for us to have that. A second area that I feel like was really important was working in a community health center that provides excellent services and models that, so that people know that they have access to culturally competent services, the right language whenever they see a healthcare provider, while at the same time we conducted advocacy and engaged our patients in sharing their stories and testifying in the media or in Sacramento or in the capital, the state capital, about the issues that they're facing that are very challenging to their living circumstances, whether it's access to care or other types of barriers that they're facing, financial or cultural barriers, and helping them figure out ways in which they can speak up for themselves and actually influence health policy. That is something of a principle and a dual mission at Asian Health Services, and we continue to do that today.